My name's Cam. I'm a nurse, mother of 3, and a grandmother of 3. And my journey with chronic pain started about 15 years ago. I developed a hernia, and when the surgeon went in to repair the hernia, I suffered nerve damage in my left groin. The pain started off just feeling like someone was tearing my flesh, just trying to rip it open with their hands. It was just a very hot, tearing pain. I have tried numerous different methods of trying to control the pain, as well as 13 different surgical procedures, narcotics, a lot of side effects with some of them. Some of them helped dull it, but nothing really controls it. Living with chronic pain causes numerous struggles in my life. Just climbing the stairs to go up to the bathroom or to go up to bed or to just go up to get something was very difficult. I always had to really rely heavily on holding on to the railing and practically helping pull my body up. The chronic pain eventually led to depression, and I had to go on antidepressants for that, which even further complicated my life. I stayed inside my house probably 75% of the time. I wasn't able to be the mother that my kids were used to me being. I wasn't able to play with my grandchildren. I was missing a lot of work for surgical procedures. I was having to miss work because I couldn't sleep because of the pain. So I had to quit working, which had a large impact on me personally. And it impacted my family in a financial way that has really changed things drastically for us. It took pretty much most of my life and activity away from me. I had done a lot of research, and I knew that the DRG therapy was probably the best option I had. It was the only thing out there that was going to be able to pinpoint that pain.
When I first met Cam, she was actually suffering from groin pain for over 15 years. And you could see the despair in her eyes when she saw me, since she had gone through so many treatment options even before reaching me. Dorsal root ganglion stimulation is a very specialized form of what we call neuromodulation. What's great about DRG stimulation now is that we're able to localize very focal pain patterns and treat them very effectively.
After having that final implant and getting my DRG therapy, the difference that it's made in my life has been incredible. I know now I can look forward to my future, where before I was kind of dreading my future. It was hard to just live laying on the couch and being in pain every day. I can do so many more things that I have not been able to do now for a very long time.
Following Cam after the procedure, she has done extremely well with DRG stimulation. You can see a significant change in the way she views life and the way she's actually looking at moving forward now.
Finding the DRG therapy was a lifesaver for me. It has incredibly changed my outlook, gives me the opportunity now to enjoy being a wife and a mother and a grandmother to those 3 wonderful grandchildren that I have. Just being able to know that I can get back to my nursing career and all the future things that I have to look forward to.
These are actual patient stories. The stories are the experience of these individuals only. Although these patients did not experience complications, there can be risks and potential complications associated with the use of medical devices. If you are interested in learning more, please consult your physician. The speakers in this video may be paid by St. Jude Medical, but the content of this presentation represents the beliefs of the speaker and not necessarily the views of St. Jude Medical. U.S. Indications for use. Spinal column stimulation via epidural and intraspinal lead access to the dorsal root ganglion as an aid in the management of moderate to severe chronic intractable pain of the lower limbs in adult patients with complex regional pain syndrome, CRPS, types 1 and 2. Study subjects from the ACCURATE clinical study had failed to achieve adequate pain relief from at least 2 prior pharmacologic treatments from at least 2 different drug classes and continued their pharmacologic therapy during the clinical study. Please note that in 1994, a consensus group of pain medicine experts gathered by the International Association for the Study of Pain, IASP, reviewed diagnostic criteria and agreed to rename reflex sympathetic dystrophy, RSD, and Kyphalgia as complex regional pain syndrome, CRPS, types 1 and 2, respectively. CE mark. The spinal modulation neurostimulator system is indicated for the management of chronic intractable pain. Australia. The spinal modulation implantable neurostimulation system is indicated for spinal cord stimulation, SCS, for the management of chronic intractable pain of the trunk and/or limbs. U.S. Patients who are unable to operate the system, who are poor surgical risks, or who have failed to receive effective pain relief during trial stimulation. CE mark and Australia. Patients who have an active implantable medical device including, but not limited to, cardiac pacemakers and cardiac defibrillators are unable to operate the system and are poor surgical risks. Warnings, precautions. Diathermy therapy, implanted cardiac systems or other active implantable devices, magnetic resonance imaging, MRI, computed tomography, CT, electrosurgery devices, ultrasonic scanning equipment, therapeutic radiation, explosive or flammable gases, theft detectors and metal screening devices, lead movement, operation of machinery and equipment, pediatric use, pregnancy, and case damage. Adverse events. Painful stimulation, loss of pain relief, surgical risks, for example, paralysis. Implant manual must be reviewed for detailed disclosure. Refer to the user's manual for detailed indications, contraindications, warnings, precautions, and potential adverse events. Caution. Federal law, USA, restricts this device to sale, distribution, and use by or on the order of a physician.